We have to learn to love life even while we're losing it all the time. Being a human is just a tricky, tricky thing. You have to be aware of this future and somehow not be afraid of it. I'm B.J. Miller. I'm a hospice and palliative medicine physician, educator by training and by vocation. Where I'm coming from is largely the sort of existential and spiritual and social pieces of this work are of particular interest to me. Palliative care, so poorly understood. It often gets conflated with just strictly end-of-life care. Hospice came first in this country in a way, at least in the modern sort of medical era. In some ways, all of this is a return to old ways of working. But for clarity's sake, in the modern 20th century, 21st century, all this is relatively new in the Western medical system. One of the problems with the hospice benefit as such is to get this kind of care, you have to have 6 months or less to live, and you have to give up any curative intended care to get hospice. So those are some pretty significant forks in the road. They used to be less so because there weren't so many different treatments to try. So it wasn't you didn't have to give up something to go with hospice. Increasingly, that's a sticking point. We're terrible at prognosticating. We have all sorts of treatments to try. So this divide is proved problematic. So that's a backdrop that palliative care rose to prominence in the 80s and 90s and 2000s, which is essentially the medical field saying, hey, hospice is so great, this sort of loving, interdisciplinary, supportive care. We're not trying to fix anyone. We're just trying to accompany you, help you feel better, be with you as you go through this sort of final chapter of life. Why do we wait till you're dying to give you this kind of care? It's so beautiful. It's so loving. And people, it's appreciated. And so really in the 90s, people got together in the medical world and developed palliative care as a sort of a larger, younger cousin of hospice to grow up around the hospice benefit. So it's the same type of interdisciplinary care, all bent towards quality of life, in never trying to fix you, just trying to help you work with what you got. So palliative care is this version of hospice that doesn't matter if you're dying in 6 months or 60 years, and you can get curative intended care as well as palliative care right next to it. So since 2006, it's now an official subspecialty of medicine called hospice and palliative medicine. Palliative care and hospice are deeply related, but palliative care is the version that does not require you're dying anytime soon. So that's a really, really important point for your audience to understand, because if you have a diagnosis of pretty much any serious illness, and you may have years and years and years to live, but you're really struggling and suffering from treatments or from the disease itself or from the loneliness that can come, palliative care is absolutely right for you. You do not have to be dying anytime soon to get it. Total pain. Nowadays, we talk about that as suffering. And we understand suffering to mean it has a physical component, has an emotional component, a psychological component, a spiritual component, a social component. It's sort of a total experience, a total human experience. Instead of focusing on an illness, we focus on suffering. That's the problem we are trying to address. That is very subjective. That is very universal. How any of us experiences suffering is different. So it's a field devoted to the subjective sense of things, which right out of the chutes makes it different from the rest of healthcare. As a patient, for one is I would not overthink it. Ask your primary care doctor or your oncologist, whoever is your sort of main physician or team. Ask them if they think palliative care might be right for you, or even if there's access to palliative care within your health system or in your area. While we're on that, there's a good web-based resource for you called getpalliativecare.org. Basically, if you're suffering more than you think you need to, whether it's because of symptoms or because of crappy communication with your medical team, or because you're really lonely, or you can't find the care you need, or whatever, for whatever reason, if you are really struggling from serious illness in ways that you don't think you have to, or more than you need to, then seek out palliative care. The common problem is not whether people get to palliative care too soon, it's people wait way too long because this over-conflation of palliative care equals end-of-life care. Most people don't want to think of themselves as dying, even if they already are, and so it keeps people sort of not wanting to look at palliative care, which is a real shame. It's for the reasons we already said. It has nothing to do with dying tomorrow. It's just, can you have the most meaningful, joyful existence within the context of your illness that you can possibly find? If you're dealing with serious or chronic illness and you're suffering in any way, reach out to palliative care and give it a try. Explicitly, hospice and palliative medicine has set itself up to address sort of, and this is a wonky phrase, but it's the term of art, which is the unit of care is the patient and their family. And by family, it's not necessarily blood. A lot of us are closest to family by choice versus by blood. So patients and their families, because as we know, you don't go through illness alone. You don't exist in a vacuum. My mother lives with chronic illness. Her illness affects my whole family. You can be the patient or someone caring for a patient, and all of the above are welcome in palliative care. The phrase palliative care was coined by Balfour Mount, who was a surgeon in Montreal who trained with Cicely Saunders and the tenets of hospice. Because of everyone's allergy to death, people heard about hospice and freak out. No one would want to address it. So he was trying to circumvent the problems of messaging with hospice. So he coined the word palliative care. Now palliative care has absorbed the baggage of death and stuff, that other things that people really often are afraid to talk about or think about. And so now the field of palliative care is considering changing its name to something else, because we keep fleeing this problem around messaging. I think that's a losing battle. The baggage will follow us. I think what I and many others, and importantly, is just trying to democratize this stuff. Everyone dies. Anyone who's ever lived dies. These are natural, inborn conditions of being alive. So they're not the stuff, strictly speaking, of sort of experts of this medical subspecialty. This subject matter belongs to all of us. Don't wait for me or the field. You just go out there and do it. Talk about it. Death cafes are a beautiful thing to kind of spread the word. So while the field is continuing to busy itself trying to find the right messages to break through, let's all be doing this. The reason I was ever interested in becoming a physician in the first place is because I was a patient. I came close to death when I was in college, and that really opened my eyes to the truth of our mortality, the insistence of our mortality, and also kind of what it has to teach us. Coming close to death is not fun, but boy, it's a really intense and thorough way of deepening your own sense of yourself and your own sense of the world and what it means to be alive, and how precious life is and how wild and weird life is. And it taught me a lot, and it excited me. It taught me the truth of interdependence. It taught me the truth of pain. Like sometimes I'd be in pain and I could just be even excited that I could feel pain, just that I was alive to feel anything. But death, like a lot of hard stuff, has a lot to teach us. For me, it's always been much more about meaning and meaning making, sort of existential and spiritual issues. What does it mean to be a human being? What does it mean to be alive? How do we handle this thing called life? Like, we have to kind of learn to love life even while we're losing it all the time. It's a really tricky enterprise. Being human is just a tricky thing. You have to be aware of this future and somehow not be afraid of it. I want everyone to experience some what I used to call the cosmic spanking, something that comes along is just way bigger than you and is not yours to control, that just can really wake you up. So I want everyone to have a near-death experience or something really seismic like that to offer that excuse to pay attention to your life in a different way. What the heck is death? I don't really know. What happens afterwards? I don't know. So all we really know is that it's a big fat change. And so even to democratize this subject even further, I think what we're often talking about is simply loss, or even simpler still, change. Something was a certain way, now it's something else, and something was lost and something was gained. And that dynamism of life, we all have that. Loss is loss on some level. So own your experiences. Go into your own experiences. It's not some external thing you got to go over there to master. It's much more internal.